Welcome. People are just starting to arrive. I am going to put on the record button because I always forget to do this and I don't want to miss out. Yeah, and there might only be 5, 10, 15 people today, but it'll be recorded. So you'll be able to send people to see it later. And
Oh,
a lot of other
great.
people will watch it later too.
All right, great. Okay.
So there'll be big value no matter when.
All right. Yeah.
Now I got the timer. We'll start in 2 minutes.
Oh, fine.
We'll start in about 30 seconds.
All right. Ready?
Those that are with us live, you can put any questions you might have in the chat. If you're on a computer, the chat bubble's on the top right.
Yeah.
And then I'll refer to that. Occasionally, I'll make my own questions as well as we go.
Yeah. As you usually do. Okay. I appreciate it. Your questions, actually. Yeah.
Great. Well, everybody, as far as introductions, I'm Coach Mark Rodriguez. I'm here in Pittsburgh, Pennsylvania, and we're blessed to have with us physician, Dr. Mohammed Radwan.
Mahmoud.
Mahmoud Radwan, and he is going to present to us about a guide for heat management for athletes. I think he knows a lot about this topic. He's been an international athlete and competitor himself, and the floor is yours.
Okay. Hello, everyone out there. Uh, our today topic is really important. It's about the International Sports Coaches Guidelines on Heat Management for Athletes. Uh, my name is Mahmoud Radwan. I'm a consultant physician in sports medicine. Okay. Uh, Today we are going to talk about the effects and impacts of training sessions in a hot environment, and what are the athletes going through when they exercise in the heat, or they have an events in the heat like in marathon, triathlon, or even football match or whatever. Uh, Before we talk about the details and impact and effect of heat on athletes and exercise practice, we have to know a few things about like heat gain, heat loss, and many other factors. Heat gain and heat loss during exercise, we all know that during exercise, our body gets really hot and we start to sweat out and we lose some water. Okay. So the diagnosis on the management of the three major problems which we encounter in sports during practice in a hot environment is number one, heat stroke, and number two, exercise associated collapse, and number three is the heat cramps. And we have to know the difference and the differential diagnosis of two major clinical conditions which might seriously affect athletes during practice, which are heat stroke and hyponatremia. I mean, tremendous decrease in sodium level in blood during practice. Okay. And we're also going to talk about guidelines for the prevention of heat illness. Next slide, please. Sports medicine clinicians must be well versed in both prevention and management of heat associated illness. So they would have the significant experience in dealing with such matters as they come up. As we might all know that humans can only survive core temperature more than 41 degrees centigrade for short periods. But if we are exposed to extreme heat for longer periods, then we suffer from the negative consequences of overheating. As we all athletes, we might also have a knowledge about that if our body temperature goes up to between 44 to 45 degrees centigrade, the proteins start to break down. This is what we call it proteins denature. So humans have developed an almost unmatched capacity to sweat and to lose heat during exercise. And consequently, we are able to regulate our body temperatures even during exercise of long duration in environmental conditions that might be or would otherwise be considered extreme. This is what we call it physiological adaptation. Heat injury, in particular, heat stroke, takes place to persons or occurs to persons exercising in much less severe environmental conditions when the total heat load cannot explain why heat stroke developed. And I mean, it does not closely related to the degree of temperature, but it is related to other factors, which we're going to know later on as we go and move from one slide to another. And this suggests that individual susceptibility plays a much more important role in the development of heat stroke in contrast to environmental conditions. There is also always individual variations and susceptibility between one player and another. Next, please. So now I'm going to go through the mechanism of heat gain and heat loss, how our body gain heat and how our body is losing heat. First, we have to talk about heat production. Why our bodies produce heat during exercise? It is simply because of muscle activities and metabolism. And heat during exercise is produced by both endogenous factors, factors from within our bodies, and exogenous sources, factors from outside our bodies, like the environmental conditions and extra. Exogenous sources are heat transfer to the body when environmental temperature exceeds the body temperature. If the body temperature, for example, is 37, and we practice sports in a hot environment, which is the temperature is 40, 41, so the temperature goes from the atmosphere surrounding the athlete to his body. It always heat transfer from high temperature to lower ones. The rate of heat production and the risk of heat stroke should be greatest in those who run the fastest and have the highest work rate. Next, please. Heat loss, it occurs by conduction or convection, heat transfer from your body to the surroundings, or by radiation or evaporation through sweating. While we are resting, there is a mechanism which regulates our heat core body temperature. We call it the thermal balance. It's maintained by convection of heat, the transfer of heat to the skin surface, and radiation of this heat to the environment through sweating out. During exercise, definitely more heat is produced than if we are resting. And then sweating provides compensatory heat loss through evaporation to keep our body temperature at an optimal degree, and we can continue practice exercise and training. However, when the environmental temperature equals or exceeds body temperature, this is the time then when sweating is the predominant mechanism of heat loss. Next, please. Sports people exercising in these conditions rely almost exclusively on evaporative heat loss to regulate body temperature. There is another significant factor, which is the humidity. The humidity significantly affects the sweating mechanism to cool down our bodies during exercise. The combination of high temperature and high humidity is particularly dangerous, as both will result in substantial increase in our body core temperature, even in relatively short distance races between 6 to 15 kilometers, like in marathon runners. The effects of both humidity, solar and ground radiation, air temperature, and wind speed are all crucial factors included in what we call it the wet bulb globe temperature index, which measure the core temperature in our bodies during training sessions. Next, please. The wet bulb globe temperature index is a comprehensive heat index simply used to measure the potential heat stress on human body by combining air temperature, humidity, wind speed, and solar radiation. So the wet bulb globe temperature index is used to prevent heat-related illnesses in outdoor activities and training, simply by measuring the value of our core temperature, and then we decide when we have to stop, when we have to continue. Endurance events with high intensities of exercise shouldn't be held when the wet bulb globe temperature index exceeds 28 degrees centigrade. So this is an indication or a red flag sign that we have to be very careful if we train or practice sports in such a level of environmental temperature. Intermittent activities with less heat production can be played at higher temperature, provided adequate rest intervals are allowed between bouts of activities to cool down our bodies during training sessions or during events. Next, please. Talking about, guidelines about exercise in the heat. So we have to put in our mind the clinical perspectives and what's going on if we are subjected to high heat or unsuitable environmental conditions for training or events. Appropriate clinical assessment of athletes who present after exercising in the heat is a cornerstone of good management. If you have an athlete and he's got a problem or medical problem during practice or training session or during an event, so the proper clinical diagnosis and the initial clinical diagnosis is a cornerstone of telling us how we're going to deal with such an athlete in such an emergency condition. The initial assessment is based on the athlete level of consciousness. The level of consciousness, if the athlete is conscious or not conscious. Also, it depends on knowledge of where in the race the sports person collapsed. Did he collapse at the beginning of the race, or at the middle of the race, or at the end of the race? Of course, we expect at the final stage of the race, if an athlete collapses, so it is due to environmental conditions. But if it is at the very beginning of the race, we have to consider other medical problems or other factors which affect the athlete. Athletes who are seriously ill show alterations in their level of consciousness. I mean, those who are badly affected by heat, their level of consciousness is dramatically and significantly affected and almost always collapse before completion of the race. They don't complete the race. They don't finish it off. So measuring rectal temperature, taking his blood pressure and his heart rate and the blood sodium concentration provide additional diagnostic informations about our athlete conditions. Next, please. Clinical examination cannot determine accurately the level of dehydration. You have to bear this in your mind as a coach, or if you have a team is helping you out, a medical team, that you shouldn't rely on clinical examination to determine accurate level of dehydration. There's other measures must be used because dehydration is a serious matter among athletes who go through the process of dehydration and losing a lot of fluids. Measurement of the body weight loss provides some measures of the likely fluid loss during prolonged exercise like marathon running. How do we know this? Simply by measuring or taking the weight of our athlete before the event. Okay? So we compare before and after training, and we can, at least predict how much fluid he lost and how much fluids he needs to be replaced. In longer races, more than 25 kilometers, when hypoglycemia, which is a significant level of low blood sugar, is more likely to happen, a glucometer should also be used. A glucometer is an instrument or a portable tool to measure the blood sugar, to know if our athlete is going through a significant low level of blood sugar, because it is a dramatic, real condition, and it could be fatal sometimes. In mass events, more than 4 hours, equipments for measuring serum sodium concentration must be available as well. So that potentially lethal exercise induced hyponatremia, by which I mean low sodium level, can be diagnosed faster and efficiently, and can be addressed, and consequently treatment and initial proper treatment is started right away by intravenous therapy if sodium level is less than 135 millimole or more than 148 millimole per liter. Next, please. Bear in your mind as a practice pair, whether or not the sports person is conscious or unconscious is the most important sign guiding the differential diagnosis. So there is a different line of management between conscious athlete who suffer from exercising in the heat, or unconscious athlete who collapse or he become unoriented to what's going on around him during exercise or during events. There is a big difference between two conditions. What are the causes of unconsciousness in athletes exercising in the heat? There is medical conditions which is not related to exercise, like cardiac arrest, grand mal epilepsy, attacks of epileptic attacks, or he's suffering from epilepsy, subarachnoid hemorrhage, someone who's got atherosclerosis and blood pressure together with diabetes, so he's subjected to brain hemorrhage, diabetic coma, either hyperglycemic high index blood glucose level or low index hypoglycemic coma. Exercise-related disorders are commonly addressed as heat stroke, which is very significant and very important, hyponatremia, which is low sodium level in your blood, in athlete blood, severe hypoglycemia, low blood sugar during training or during events, which is an uncommon cause of exercise-related coma in non-diabetic, okay? Maybe your player is diabetic, but we don't know. But that's why all athletes must have a scan, clinical examination, and lab tests for evaluation. What are the alert signs in unconscious athletes? This is the alert signs. First, rectal temperature more than 41 degrees centigrade. The second point is heart rate is more than 100 beats per minute. I'm talking if the athlete cannot run anymore and he's resting and his heart rate never goes back to normal. The third point is if his systolic blood pressure is less than 100 millimeter mercury, he's suffering from hypotension. If his rectal temperature is above 41 degrees, the diagnosis is heat stroke. That means his body cannot deal with a high body temperature, cannot regulate anymore his high body temperature. And the player then, he suffers from heat stroke and mostly brain insult as well. If rectal temperature is below 40 degrees in an unconscious player, and the blood pressure and heart rate are not grossly abnormal, and there is no other obvious medical conditions, like if we know that he's not diabetic, he's not having a stroke before, and things like that. So the probability is that the sports people or the sports person has gone through exercise-associated hyponatremia. His blood sodium level is really low. Or hypochloremia, which is very rare, that his chloride level is low as well, which is an electrolyte abnormality causing cerebral edema, fluids in his brain. So it is a serious conditions. Type. What are the guidelines which will help us out for determining the severity of the collapsed sports person in sports conditions? We divide it into two columns, non-severe and severe. For immediate assessment in non-severe, the player is conscious. In severe, the player is unconscious or altered mental state. He's mentally confused. He's not really on his alerted to what's going on. Okay? Then in non-severe, the player is still alert. But in severe, he is confused, disoriented, and become aggressive. His reactions are unexpected. This is not him. This is not the normal player we know. In non-severe, rectal temperature less than 40. In severe conditions, rectal temperature more than 40, maybe 41, or even before, even more, sorry. In non-severe, systolic blood pressure is less than 100 millimeter mercury. And heart rate is less than 100 beats per minute. Okay. Also, a specialized assessment like blood glucose level in non-severe, the blood glucose level is between 70 to 100 milligram percent. And serum sodium concentration between 135 to 148 millimole per liter. And his body weight loss is between 0 to 5%. On the other side, in severe conditions, his systolic blood pressure is less than 100 millimeter mercury. His heart rate still high, is more than 100 beats per minute. His blood glucose level is less than 70. So he's going through hypoglycemia or low blood glucose index. And rarely goes beyond or above 148 or 150 millimole per deciliter. His serum sodium concentration is less than 135 or more than 148. His body weight loss is more than 10%. That means he's really dehydrated. He lost a lot of fluids. And his body weight gain is more than 2% because of taking too much fluids during the events, but he could not regulate his body temperature, and the loss is more than what the fluids he was taking. Next, please. We are talking about now the heat stroke. Heat stroke that the temperature is above 41 degrees centigrade. The highest rectal temperature are usually seen in the fastest runners, like what I said before, competing in events of between 8 to 21 kilometers, okay, in a high environmental temperature with insufficient fluids intake. Symptoms that are usually associated with higher rectal temperature include dizziness. Your player will become dizzy. He will become weak, show pallor in his face. Maybe he's nauseating. He feel like he want to vomit and is having very bad headache. Other signs, he become confused and disoriented. Irrational behavior, including aggression. He becomes aggressive. Combativeness or drowsiness, becomes really dizzy. It's not feeling stable. And then progressing to coma and collapse. By clinical examination, his blood pressure is very low and his pulse rate is very high. His blood pressure, we call it hypotensive or hypotension, and tachycardia, that means his pulse rate is very high, above the normal level we measure during exercise. As we see that in this picture, the athlete collapse. That means it is a serious condition if he is gone through heat stroke. Heat stroke, the next slide, please. Heat stroke, the presence or absence of sweating does not influence the diagnosis. Okay? I mean, if you see an athlete collapsing and become agitated and with irrational behavior, and he's not sweating, it doesn't mean that he's not having heat stroke. Whether he's sweating or not sweating, and you see all this, red flag signs, so you have to know that you are coming across a condition suffering from heat stroke. Recovery of cardiovascular function occurs with normalization of the cardiac output to maintain the amount of blood going from the heart to the body system, and with an increase in peripheral vascular resistance. If during exercise a previously healthy sports person shows marked changes in mental functioning, collapse with unconsciousness, or showing a reduced level of consciousness, or even mental stimulation in the form of irritability or confusion, any or all of which these signs in association with a rectal temperature above 41 degrees, the diagnosis is heat stroke, and it is confirmed and warrants immediate initiation of cooling down his body, and you have to move as fast as possible to save his life. Management of heat stroke. Rapid reduction of rectal temperature from 41 to 38 degrees centigrade will result in better prognosis. I mean, the outcome will be much better. Place the patient in a bath of ice water for at least 5 to 10 minutes if it is available. If not, you can shower the player. Okay, shower, he can take a shower. Okay, but of course, an ice bath is much better. Care must be taken to avoid inducing hypothermia. Don't cool him down more than supposed to be. Don't overdo it. Otherwise, you will go from hyperthermia, high body temperature, to hypothermia, which is also problematic for the athlete. Shivering indicates that core temperature has decreased to 37 or even below. So it is a clinical sign or a sign for any person who can see that the athlete is shivering, that his temperature gone down from high to low, which is a good sign. Intravenous fluids may be given to correct the expected dehydration and to assist in stabilizing hyperkinetic circulation if the player is really suffering from dehydration. Otherwise, if we give him intravenous fluids and he is not dehydrated, he will go in overhydration, which is really medical problem as well for the athlete. Rapid 1 to 1.5 liter of 0.5% or 0.9 saline can be given initially by intravenous. However, cardiac function is compromised in hyperthermia in high body temperatures, and aggressive fluid therapy can induce pulmonary edema, which means more water will be collected and translated into his pulmonary system and lungs, which is not a good condition. We need to put our players into more stress. So we have to be careful when it comes to giving him fluids. Mortality from heat stroke should be zero in healthy athletes who are cooled promptly. Okay, and this is a very important note point. Next, please. Indeed, it is usual for sports people to be fully recovered and ambulatory become mobile within 30 to 60 minutes of collapse, providing they are correctly and efficiently treated and they don't have a predisposing medical condition that explain their increased individual susceptibility to heat stroke as a clinical case, known as exercise-induced malignant hyperthermia. That means his temperature becomes unresponsive to the measures which we mentioned before. Why? Because he has an underlying medical conditions which we are not aware of about our player. Maybe he's diabetic, he's having blood pressure problem, we have other grand mal epilepsy or whatever, and we don't know it. So we have to have a full medical history about our players. Any delay in a cooling therapy can convert an uncomplicated case of heat stroke into a potentially fatal condition. So we have to be very careful, or have to move faster to cool down his body by taking the measures in consideration, which we mentioned before, to be introduced to our player. However, very rare cases of heat stroke follow a malignant course with a fatal outcome occurring within a few hours despite appropriate medical care. Very rare to see very dramatic condition. What are the complications of heat stroke? Cardiovascular effects on the heart, cardiac arrhythmia, irregular heartbeats, myocardial infarction. The heart becomes unable, the cardiac muscle unable to, produce more blood or to pump it into our cardiovascular system. Pulmonary edema, which means collection of fluids within our respiratory system. Neurological factors like coma, confusion, and stroke. Gastrointestinal consequences like liver damage and gastric bleeding. Muscular negative effects like rhabdomyolysis, which is breakdown of muscle tissue. Hematological blood problems like disseminated intravascular coagulation, by which you means blood clot in your blood system, which is really serious condition. And some cases might go through renal failure. Next, please. Is hospital admission is indicated or not? For follow-up and close observation is very important. You save the life of an athlete, and he becomes okay. There is no point why shouldn't we refer him to hospital. It's better if we refer him to hospital for further follow-up and close observation, because his condition might be deteriorate later on. So we have to follow him up closely under the supervision of professional medical team and available equipments. Hospital admission also is indicated if there is failure to regain consciousness within 30 minutes after proper treatment that return rectal temperature to 38. Yani his temperature goes back to normal, but still our player cannot regain his consciousness. So we have to shift him right away to hospital. Also, failure to achieve cardiovascular stability during this time is an absolute indication for hospital admission. A persisting case of tachycardia, increased heart rate, even though all measures been taken to cool him down and to cure him, but still his heart rate is still very high. And his blood pressure is still very low. Even in the supine head down position, suggest that cardiogenic shock is developed. If we put him in a position that his head is down and his pelvis and legs are up, and even though his blood pressure is still very low and his heart rate is very high, so we have to shift him to hospital right away. Is the hypothermia cause of condition or merely a sign of another potentially more serious condition? We have to shift him to the hospital. Next, please. Is urgent intensive care indicated in such cases? Yes, sometimes, yes, it is. Rhabdomyolysis, severe cases of muscle damage and breakdown with evidence of a disseminated intravascular coagulation, blood clot, like embolism. This condition required urgent intensive care treatment. How would we know? Your player is unconscious, he's in severe bad conditions, he cannot stand on his feet, his muscles are very floppy and very weak. So and his blood pressure is very low, his blood sugar is very low, his heart rate is very high. You have to shift him right away to intensive care. The classic triad of rhabdomyolysis, which is remarkable breakdown of muscle tissues. This triad is severe muscle pain, unbearable severe muscle pain, which is not responsive to painkillers. The second is muscle weakness, very weak muscles, dark or tea-colored urine. All these signs are classic triad why you should shift your player right away to the hospital and be admitted into intensive care unit. Confirmation of diagnosis via blood test to measure creatine kinase, which is a marker for muscle damage, is only maybe available in hospital, but could be also available with some portable equipments, small equipments, if you have it. So if it's very high, you have to take him to hospital right away. Treatment by intravenous fluids, electrolytes correction, and medications adjustment. Next, please. Another serious condition is exercise-associated collapse. Collapse that occurs in sports people who successfully complete endurance events without distress, but all of a sudden afterwards develop symptoms and signs of postural hypotension when they stop exercise. The blood pressure go down all of a sudden, and he fainted and become unable to stand on his feet. In such cases, if rectal temperature is elevated and the player has an altered level of consciousness, heat stroke is a correct diagnosis. There may be abnormal perfusion of the splanchnic circulation, the GIT area, with loss of a large fluid volume into the highly complained gastrointestinal veins. Dehydration cannot be an incriminated factor in collapse. Don't always address dehydration as the main cause of unconscious collapsed athlete. Don't rely on this. It is a crucial factor, but don't totally rely on dehydration problem. The diagnosis of exercise, diagnosis of exercise-associated collapse can be made on the basis of a typical history. Finding of postural hypotension, very low blood pressure, reversed by lying supine and your player head down and pelvis and legs elevated, and exclusion of readily identifiable medical syndromes such as diabetes and heat stroke. That means that the condition of your player can be reversed and can be corrected. Next, please. Management of postural hypotension and exercise-associated collapse. Exercise-associated postural hypotension patients, if are conscious, so encourage them to take fluids orally during recovery. Sports drinks containing both glucose and electrolytes are appropriate for the athlete, and providing a sports person that does not have evidence of fluid overload. Don't give him too much fluids, more than he really needs. Managing the player in head down position with pelvis and legs elevated is always dramatically effective, and producing a more stable cardiovascular system within 30 to 90 seconds, usually with instant reversal of symptoms. So this position is very important. Put your player in a head down position with his pelvis and legs up. This is what we call the Trendelenburg position. There is a bid for this, okay, but you can, if you don't have it available in an event or training location, so you can use any other things by managing to put his head down and his legs and pelvis up. Most sports people with exercise-associated collapse are able to stand and walk unaided within 10 to 30 minutes of appropriate treatment. They become okay again. Intravenous fluids should be introduced only if there is a strong evidence of dehydration. How would we know if we are like coaches and assistant coach? If we look at that our athlete mouth is very dry, he cannot spit, out. If he's losing his skin turgor, if he pinches his skin up and his skin never goes back to normal, it's becoming wrinkled. If he got sunken eyeballs, or if he unable to talk and he's very, very, very thirsty. Next, please. Management of exercise-associated collapse as well. We have to continue intravenous therapy only if the patient is managed in Trendelenburg position with head down, pelvis and legs up. If his heart rate more than 100 per minute and still hypotensive. In such cases, the possibility of an underlying cardiac condition causing a reduced cardiac output must be considered and properly treated. One more important issue is heat cramps. Yeah, excuse me, please. Cramps can occur at rest, during exercise, or even after exercise, undertaken in any environmental conditions. Whether or not an athlete practice in high environmental temperature or even ordinary stable environmental conditions, he can have cramps. The popular belief that cramps are caused by severe dehydration and large sodium chloride loss that develop during hot conditions has no scientific basis. It's not evidence-based medicine. They are either specific. They are specific neither to exercise nor to exercise in the heat. So don't link it always heat cramps to increased environmental heat levels or temperature levels. The most recent hypothesis or theory possesses that cramps are most probably result from alterations in spinal cord neural reflex activity, activated by fatigue and not by high body temperature. So you have to bear in your mind, maybe your athlete is becoming really fatigued from exercise. Fatigue increase excitatory signals to the motor nerves, causing persistent muscle contraction and inhibit or stop muscle relaxation. The term heat cramps should be abandoned as it clouds understanding of possible neural nature of this condition. Next, please. Management of cramps. How can we manage cramps? Muscle stretching is very effective. Application of ice and ice massage of the affected muscle may also be very helpful. Oral fluids if signs of dehydration are evident. Intravenous normal saline and intravenous magnesium therapy have been used in triathlon. However, clinical trials of either treatment have yet to be published and clinically approved, but it is very effective. More recently, evidence has accumulated that the ingestion of pickle juice may speed up recovery from cramps by a central neural mechanism faster than water. It's not because you replace water loss by giving him juice that will be okay, but because of central neural mechanism and stimulation of the neural nerves in the spinal cord. Pickle juice contains acetic acid. Pickle juice contains acetic acid, which sends signals to spinal cord to calm overactive nerves. So excitatory nerves are become more calm and they don't produce too much discharges. So your muscles have the chance to relax and not to be persistently contracted. Okay? Just sip a small amount. Let the athlete or the player sip a small amount slowly, followed by water because of its high sodium content. Fluid overload hyponatremia. Low sodium level is perhaps the most important differential diagnosis in athletes who seek medical attention at endurance events, who undertake in the heat lasting 4 or more than 4 hours. Any sports person who become unconscious during or after ultra distance running or triathlon races and whose rectal temperature is not elevated should be considered to have symptomatic low sodium level, a medical condition. We call it hyponatremia. Until measurement of the serum sodium concentration confirmed the diagnosis. Sports people with exercise associated low sodium level and serum sodium concentration below 120 9 millimole per liter, are overhydrated by between 2 to 6 liters. And the physician should be aware of this diagnosis in a patient with an altered level of consciousness. If the player is conscious, he may complain of feeling bloated or swollen. Accordingly, race identification bracelets feel tight, okay, and noticeably become really tight because of fluid accumulation. Also, there is another significant sign, which is vomiting of clear fluid is another indication of overhydration. Management of exercise associated low sodium level. Bladder catheterization in a hospital to monitor the rate of urine production during recovery is very important to prevent the consequences of renal failure. Also, spontaneous recovery will occur if urine more than 500 milli per hour. No fluids by mouth should be taken. Salt tablets and sodium-containing foods shouldn't be taken during unconsciousness. Okay? High sodium solution given intravenous provided that they are infused by very slowly intravenously. The use of diuretics may be justified to initiate diuresis if we need to. Next, please. Sports drinks in hyponatremia, low sodium level. Sports drinks play no role in prevention of low sodium level. The sports drinks are markedly hypotonic and their ingestion adds substantially more water than sodium to the body. Exercise-associated hyponatremia is always also due to excessive secretion of antidiuretic hormone with resultant water retention and sodium diuresis. More water become stored in the body, and low sodium will induce diuresis. Thus, the ingestion of any fluids, regardless its sodium content, will cause further fluid retention and excretion of all sodium present in the ingested fluid. So it's not helpful to give him sodium content. A recent study funded by the sports drink industry confirmed that sodium ingestion during exercise produced no significant effect. However, this study and other researches is still debatable. Next, please. Guidelines for the prevention of heat illnesses. First, perform adequate conditioning is very important. Acclimatization of competing in unaccustomed heat or humidity. Avoid adverse conditions. Alter training times. You can always control training time. Wear appropriate clothes. It's very important. Drink an appropriate amounts of fluids before the event and during the event, and after the event as well. Sports people can be assured that they need to drink only according to the dictates of their thirst. Ensure sports personnel and officials are well educated. You have to teach them, you have to educate them. Provide proficient medical support. It's very important. Thank you so much. And this is the end of our topic. Thank you.
Excellent. Some excellent materials. Could anybody that has any questions, I would love to see them in the chat so that we can ask the doctor your questions. I do have some questions myself. I'm just trying to get what happened with our attendees. Are all here. We have about 8 of them there. Did the doctor, are you still here?
Yes, I'm here. Okay.
Great. Yeah. So you talked about a glucometer device. Glucometer device. It's, could you explain that a little bit? Is that something that's readily available?
Glucometer device.
Yes, I've never seen or heard
Okay,
of that.
the glucometer device is a medical tool. It's very small and portable, which is used to measure your blood sugar. Okay, simply by using strips and taking a drop of patient blood. Okay, after from one of his from the thumb or index finger, and then a drop of blood is applied to a particular spot on the strip, and then it will measure your blood sugar. So it is it's really very valuable. It will give you an indication whether or not is your player is suffering from hypoglycemia, or if he is normoglycemic or hyperglycemic. If he is hypoglycemic, his blood sugar below 70 milligram percent. So his blood sugar always between 50 to 60. And this is a dramatic critical conditions. You have to give him, like maybe a spoon of honey, chocolate right away, syrup right away to put his blood sugar up. Okay? This will be a great help. Otherwise, he will go into hypoglycemic coma, which we call it low index blood sugar coma. It is fatal condition if it lasts for more than 1 to 2 minutes, because there is a brain insult and there is no blood goes. The blood sugar goes to the brain, is terribly deprived. Okay, so and any person cannot really resist a very low level glucose level in the brain. Or if his blood sugar is normal between 70 to 108, 110, or maximum 120, that means he's okay, he's in a good condition. Or if he is hyperglycemic, of course, an athlete or ordinary person who is not diabetic, his blood sugar will never go up during exercise or post-exercise. But if it's really high, that means this person, he is diabetic. He
Now,
is diabetic.
is that device often in the medical kit for a special event or for the the emergency responders?
Yes. Oh, yes. Yes.
Okay.
But you can save the life of an athlete or even a normal person who is hypoglycemic if you see him really dry, his tongue is really dry, he's very thirsty, his lips are cracked, and he cannot talk and he cannot spit out, that means he is hypoglycemic. So you have to rush giving him anything got a high sugar content. Okay? But bear in your mind, there is something else. Maybe he's hyperglycemic and he's also lost fluids and he's dehydrated. So, and you might think that if I give him a sugar containing substance, it's fatal for him. No, it's not fatal. It's only fatal if you don't give sugar to someone who is hypoglycemic. Okay? You got my point?
Yes.
Okay.
Important. Now, you talked about two other devices, a device for rectal temperature, and then
Yes.
how was that done?
For measuring the rectal temperature is very simple by buying a thermometers, which is used to record your your body temperature by putting under your armpit, okay, or under your tongue. Okay, this is not an accurate way of taking your body temperature. The accurate way is you put it in the opening or the orifice of rectum. Okay, the lowest part of your gastrointestinal system. This is very accurate. Simply by putting a lubricating material like gel or whatever, and then you insert the thermometer into the rectum. Within 1 minute or less, it will give you the accurate temperature. Because if you put it under the tongue, sometimes the player is confused. And if he's agitated or aggressive, he might break it. And now he will go through the hazards of swallowing mercury. And you goes from one problem to another serious matter, okay? But avoid putting any thermometers and taking the picture under the tongue in events or if a player is confused or unconscious. Don't do it. It's more safer if you put it under the armpit. And if the reading is like 38.5, add up at least 0.5 more, okay? But rectal temperature is reliable, very reliable for the proper diagnosis of heat stroke, okay?
Yeah, I would worry a little bit about a safe sport issue with the other alternative. I think the under the armpit might seem best.
Yeah.
Now, you can also just, they have
Or
a
you can
gun
use the
now.
strip. Yes, you can use the strip. Yeah, you can
Okay.
use it, but you add up 0.5 to the reading.
Great. Now, my friend actually, right as we speak, is in a 100-mile race. That's about 160K on the trails. And he was going for IV fluids before the race, the night before. Is that something that is often done? What are your thoughts about IV fluid intake before a big event?
You mean preventive measures before events? Well, I don't know. As far as I'm concerned, uh, it's not going to be effective and it's not going to be helpful to your athlete. Plus, it might be prohibited and banned by WADA. Okay?
Oh.
So they consider it a doping issue. You know what I mean?
Yes.
But if, I've been through a lots of competitions and events. If your player is trained well, with a proper cloth and educated well to take fluids, when and how much, and is having optimum, nutrition and the sufficient sleeping hours, and follow your guidelines or instructions regarding exercise, I rarely see someone who needs any fluids or any tonics or any things like that before even marathons. All they need fluids. Fluids is important, but even sports drinks, and conditioned training before going through big events.
Now, I understand you grew up in Egypt or was a youngster in Egypt. I imagine you have a lot of stories about, exercising or playing out in the heat there, right? Can you share
Yeah,
any stories, especially about
especially,
being a youngster?
especially during Ramadan, the fasting month. The
Yeah.
fasting month. I don't know if you are aware of it or not.
Yes, I am. Yes.
Actually, look, I was an athlete myself. I was an athlete. I was a professional handball player. Okay, and in my time, what we used to do, we used to have fluids before. In my time, because that was in the late 70s. I'm too old now. We didn't use, we are not used to sports drinks. The era of sports drinks becomes in the 80s and afterwards. So we used to have like a proper meal before training, 3 hours before training, and we used to have fluids, which is water, mainly water, every now and then, before, during, and after training. So we, even though the temperature is high, we never train daytime, early daytime, maybe late daytime or evening time. Okay, that's the best time to train. You have to choose. You have to be flexible in choosing the time for training.
But the youngsters,
Youngsters, we never let them train in a hot environment. Never.
okay.
Because because it's very dangerous, Mark, to train youngsters in a hot temperature. Why? He can easily have a brain insult and he can easily have a collapsed athlete when he's young, and their central nervous system cannot cope with the high environmental heat. We never let them train in a hot environment. No way. No way.
Okay, well, here's another cultural thing. In the United States, we often, after an event, have a beer. Now, I know that they don't drink much alcohol elsewhere, but what do you
Yeah.
say to people, drinking after a marathon or a half marathon, then going ahead and drinking the beer? Is the beer a good
This,
fluid or no?
those people, they might go through alcohol intoxication. Alcohol intoxication, by which I means their liver will be badly affected. Plus, they will go through dehydration as well, you know, because alcohol is a diuretic. It's like that, it makes them go to the toilet and they lose a lot of fluids in passing urine. And this will be an add-on to their dehydration problem. No way I will, I don't know. I wouldn't advise them to drink, Maybe they can take some, some alcohol, very little for social, yeah, just like, toasting a champion or whatever. But it is really critical to take a big amount of alcohol after training or after competition or in celebrating an event.
And lastly, I am in Pittsburgh, where the pickles and the ketchup and Heinz are very big. So we like the pickles, but
Yeah.
the pickle juice seems to be a little more recent, that people are talking about it or consuming. You can buy pickle juice in a container now. What's your thoughts about the pickle juice?
Actually, it is not very recent updated way of using pickles and to treat and to alleviate the symptoms of dehydration. It's maybe some athletes long time ago. We know athletes used to do this, but it's becoming more like a trend, which is proved to be really effective in alleviating the symptoms of dehydration. But it must contain with water because it's salty. You have to drink water afterwards because it's really very salty. It is effective and it's not harmful. The only thing is it is very salty, So you have to drink some water. But I wouldn't encourage having pickles in ketchup. I wouldn't, because ketchup, they have preservatives and additives. So you don't need it as an athlete. Maybe an ordinary normal person, it's okay. But for athlete, I wouldn't encourage it that much.
Okay, I'd like to throw it out to other people if they would love to enter the conversation. They could put something in chat or ask or make a wave. I could ask you to unmute, and we could see if people had other things to add. I would like to hear your stories about some heat exposure,
Yeah.
or even if you drink pickle juice in your neighborhood.
We would love to hear coaches' experience if they encounter heat problems with their athletes.
Yes, coach. I have a question. Hi, coach.
Hi, go ahead, Jules.
Yeah. As with my experience as a endurance athlete, I'll take a salt stick and power gel also. So how do you recommend taking a salt stick and power gel during the extremely exercise, coach?
Coach Mark, could you please repeat that question for me? Because I
Yes.
didn't quite hear it. I didn't
Okay.
catch it.
Sorry, coach. As an endurance athlete, I'm taking salt stick and power gel too during
You take a
exercise,
power
coach.
gel? Power gel?
Yes, coach. Power gel and
Power
salt
gel
stick,
and what?
coach.
Power gel and what else you taking?
Salt stick, coach. Salt stick.
Okay. Okay. Like I told you before, some players or some athletes are used to take salty containing substances like salty tablets and things like that. It proved not to be really effective, because the more salt you take, this will stimulate your kidneys to produce more water and you lose more water. The more water you lose, so you're going to be maybe you're going to be dehydrated. So you need more water to drink to replace the fluid you lost. So we do not, as a medical professional, I wouldn't recommend or strongly recommend to have salt tablets be taken before events or endurance events or competition or things like that. Maybe power jelly or like snacks which will give you some sort of energies. It's all right. It's okay as long as it's not banned and it's not prohibited by WADA organization. Okay, so it's okay. There is no harm in taking this, but I'm not in favor to encourage your athletes as a medical professional, as a doctor, because we go by evidence-based medicine, and I'm dealing with sports athletes for so long, you know. So I don't encourage them to take salty tablets before events. Encourage them to take fluids. Sports drinks are okay, no problem. Before events, during events, and after events. Okay.
Okay, coach.
I
Thank you.
hope. No, you're welcome.
Any other questions from our esteemed guest or for our presenter? Yes, I have to ask you to unmute. There's a wave. Casino Jr., can you?
Coach,
Coach, how about honey and Bokari during marathon?
yes, coach, during the marathon.
What's Bokari? What do you mean by Bokari?
Pocari Sweat, coach, this electrolyte energy drink.
Okay. You mean your players? You want them to give them some honey during training?
During the initial competition, coach.
Yeah, well, no. Some people they mix honey with water, even though it's not very soluble in water. But some people they mix honey. What kind of honey you are talking about? Because honey, there's
Uh,
different kinds of honey. There's molasses, what they call it, the black honey, and there's the other one, the pure
the
honey.
the pure honey, coach.
Okay, pure honey. Let me give you this. Pure honey is full of sugar. You know, pure honey is full of sugar. It's a kind of carbohydrates. Okay, and it boosts up your energy system. It gives you energy. Definitely, it does. It's a good energizer for your athlete. But the only thing will be taken against taking honey during training is it elevates your blood pH. By elevating your blood pH, you feel like there's some sort of acidity, so you feel heartburn. Your athletes start to feel heartburn. And this heartburn is very irritating. You know what I mean? And you cannot mix it with water. You cannot mix it with water. However, it is strongly recommended to give it to your athlete after training, not during training. You can give it before or after, but not during training session. Okay? It's good.
Thank you.
There's no harm in it. About Pokari, if it's a sports drink, is it available in the Philippines?
Yes, coach. I'm not in the Philippines, coach. I'm in Timor Leste.
Okay. Is it? I don't know what's the contents of Pokari. If it is a legal drink and approved by FDA, Food and Drug
Yeah.
and the Drug Association, and proved not to be prohibited by uh, World Anti-Doping Agent, so it's okay, no problem. No, it's okay. Sports drinks are really good and preventive measures for dehydration and giving some sort of energy as well, the calories as well. Mm.
Thank you, coach.
You're welcome.
Well, we've been talking for more than an hour.
Yeah.
70 some minutes. So I think we should say all thank yous and greatly appreciate the expertise. And you've always been a very loyal supporter and excellent presenter for the things that happen here. This presentation will occur and be put online soon with the WAFSU.org, and we have all of our bygone seminars in a course that people are very welcome to review some of those past things. And if anybody else has things to say, this is the time to do it. Otherwise, we'll be dismissed. And there is going to be a seminar in basketball in about 40 minutes or so. We'll return to the scene, but we'll be able to stretch our legs or to take a run or check your temperatures.
Okay. Thank you so much, Mr. Mark, for having me. And I hope that all coaches will benefit from the medical information I provide for them. Thank you so much.
Thank you so much, Coach. I really love your discussion today. Really appreciate. Thank you and God
Thank
bless.
you.
Thank you
Thank
so
you.
much, Coach. Yeah. God bless you, Coach.
Thank you. God bless you all. Okay.
Okay. Peace. I'm going to end the meeting and we'll resume in about 30 or 40 minutes.
Okay. Thank you. Bye.